Hello, welcome to Preventing Falls by Mary Washington Home Health. My name is John Adamson, physical therapist with Mary Washington Home Health. We hope that after you watch this brief video, you'll have a good idea of how to prevent falls on your own. This video is not intended to prevent you from seeking proper medical attention. If you are falling, please seek out a healthcare provider to examine you. Sometimes a simple medical treatment will reduce or eliminate your falling. There are two general categories of things we can try to do to control falls. Of course, life sometimes throws you a curveball, but these things are two general categories you should think about when you are falling. First of all, there are intrinsic factors. These are factors within yourself that cause fall risks. For example, vision. We rely quite a bit on our eyes for balancing ourselves. If you're having a fall, you may have problems with your vision. Heart. As we get older, sometimes we do suffer from heart conditions that can predispose you to falls. Sensation. Sometimes people have disorders such as diabetes that reduces their sensation in their legs, which can cause them to fall. Ears and hearing. We have mechanisms within our ears that are related not just to hearing, but also to balance that should be assessed. Also, we can control things like strength, flexibility, and aerobic conditioning. You are much more likely to fall if you are weak, inflexible, and have a problem with your cardiac or pulmonary conditioning. Also, things like incontinence can be problematic and can lead to falls. There are some things that are outside of us, and sometimes these are outside of our control, but we can seek within our own environments to change them so that we'll reduce our risk for falls. For example, the home environment. Make sure you remove clutter, throw rugs, have good walkways where you can walk through easily. Make sure you can control pets. I recently had a patient who had a fall because a dog got between his legs while he was walking. Lighting. Along with vision, proper lighting can really help with reducing your falls. There are also aids that can assist us. Better to use a walker than to have repeated falls. And also medications. Sometimes medications can predispose you to falls, such as causing balance disorders or problems with your heart rate response. If you're falling, ask yourself the following questions. Things like, when do I fall? Where do I fall? What activities am I doing when I fall? Have I had a recent change in my glasses? Things like going from a single lens to bifocals, for example, will cause balance dysfunction. Medications, health. Am I down or depressed? Depression can lead to a number of medical issues, including a greater risk for falls. Am I drinking enough liquids? Low blood pressure can be associated with lack of proper hydration. And is my environment safe? Hopefully this brief presentation will help you in combating your risk for falls and perhaps reducing the falls that you are currently having. Again, always seek medical attention if you are having falls.